তাহলে যত কম হাত ধুতে পারে, আর যদি আমি বারে বারে একবার এসে একবার হাত ধুতে থাকি,
Increasing or decreasing?
Getting worse over time.
Getting worse over time. Okay, is it painful?
No.
Okay, is it blanchable?
No.
Causing you itchy, or is it itchy for you?
No.
Is it oozing?
No.
Do you have a sensation over it, or you lost sensation over this rash?
No problem with the sensation.
No problem with the sensation. Okay. Can you tell please, is it increased with sun exposure?
Not sure about it.
Not sure about it. Okay. Do you take any medications recently?
No.
Do you take any medications for any reason?
Show me your medication list. I'm not receiving
Show me your medication list. Okay. Okay. Do you have any chronic disease I should be aware of, like diabetes or hypertension?
No.
Have you experienced any fever?
No.
Any weight changes?
No.
Okay. Any joint pain anywhere in your body?
No.
Okay. Any muscle weakness or any skin changes other than this?
One by one, question by question. Muscle weakness? No.
Okay. Do you have other skin changes in your body?
No.
It's only in your hands only, right?
Yes.
Okay. Do you have any change in your appetite?
No.
Any weather preference?
No.
Sorry, I want to ask you this from the beginning, but can you tell me please how did this start, this rash?
Smaller than this.
Okay, with also with deep pigmentation or with loss of color of your skin, starts like this?
Yes. Yes.
Okay, do you feel fatigue, Mrs. Stewart?
No.
What about your menses? Is it regular or irregular?
Regular.
Regular? Okay, and do you take any contraceptive pills?
No.
Okay, do you have any rash in your face?
No.
Any loss of hair?
No.
Any aching in any part of your body?
No.
Okay, have you taken any medications recently?
No.
Okay, any mouth raw areas or ulcers?
Any mouth sores? No.
Mouth sores? Okay, or any sores in private areas?
No.
Have you performed any operations recently? Any surgery?
No.
Okay, do you smoke, Mrs. Stewart?
No.
Do you drink alcohol?
Socially.
Okay, I'm sorry to ask you that. Do you take any recreational drugs?
This is a question that I do ask to all of my patients. No, I do not take any.
Okay, and have you made any? Do you have any yellowish discoloration of your skin or sclera or eyes? Sorry.
Of your eyes or skin? No.
Okay. Do you have any bumps or lumps in your body?
No.
Any change in your water work?
No.
Any bowel motion problems?
Change in bowel habits? No.
Change in bowel habits? Okay. Have you received any blood transfusion recently?
No.
Hello?
No. No blood transfusions.
Hello?
Yes, Dr. Ahmed, carry on. I can hear you. No transfusions. Hello? Can anybody hear me?
Yes.
Yes, sir.
Yes.
Yes.
Okay, Dr. Ahmed, your connection maybe?
Disconnected.
Okay, we will wait a minute for him to come back. He's doing just fine. Keep a note, please, that skin rash comes in 2 questions, not in 1. You have any skin rash and you have any rash from sun exposure. 2 questions. I will stop his timer now until he gets back. We have those 2 questions because some surrogates may tell you that I do not have any skin rash, but I have a rash from sun exposure. So keep it in 2 questions rather than in 1. Let's wait for him 30 more seconds, then we will continue with someone else. This this is obviously a case of vitiligo. And we have this as a standard type of case for the exam. Pretty easy, but how to tackle it, this is the issue as usual.
Hello?
Dr. Ahmed, are you back?
Yes, I'm sorry, I lost connection.
Okay, timer, no problem. Timer is back on. Go.
Okay, and do you have any tan skin?
No,
Any tummy pain?
no,
Any dizzy spells?
no,
Okay. Any change in your appetite?
no,
Any weather preference?
no,
Okay. Any visual problems?
no,
Okay. Do you do the dishes or something like this without wearing gloves, or you use new type of soap while washing dishes?
Come again, please.
Do you wash your dishes with a new type of soap, or you without wearing gloves at home?
I do not use any gloves to wash the dishes at home.
Have you recently changed the type of soap you are washing dishes with?
Yes,
You changed the type of soap.
yes.
When exactly did you do this?
2 months ago.
2 months ago. And you experienced this problem before this, right?
Yes.
Okay. And may you know what's your job?
I am an accountant.
And how is this affecting your job? This problem?
Very badly.
Okay. And you mentioned no fever at all before this happened, right? Nothing happened
No.
before this 6 months. No fever
No.
or anything specific. Okay. Don't have more questions. Have you traveled recently?
No. You have 2 minutes remaining.
Okay. What's your concern?
What do I have?
Do you have any history of allergy? Sorry to ask you that. Any history of allergy before? Or
No,
atopy?
never.
Do you have any history of bronchial asthma or being allergic to any medications?
No.
Okay. What's your concern?
What do I have?
Well, Mrs. Stewart, we need to perform further investigations to get a better understanding of your condition. But this condition may be related to the type of soap or something irritant that you used recently or in the past 6 months, and you have a condition called contact dermatitis. Don't bother yourself with this term. Condition is related to the allergy or a reaction caused by the different substances that you use, either in washing dishes or in your daily activities. This is causing this rash.
Dr. Ahmed, you see the screen?
Yes.
Okay. Carry on.
Other differential diagnosis that may be like depigmented lesions, which occur due to a body defense mechanism that attacks your body and causes what is called vitiligo. This is a condition where the body loses its pigmentation due to a body defense mechanism.
Okay.
Do you have other concerns?
No, thank you. Okay.
Okay. من الشكل كده شكلها فيتيليجو بس ما فيش حاجه اوتو اميون معاها او اي حاجه فعشان كده that's why I.
Okay. So let me ask you first very simple questions. Very simple questions. First of all, do you have to find any other autoimmune in the case in hand?
Not a must.
Not a must. So you can diagnose one single autoimmune, but the task is always to consider other autoimmunes. Agree?
Yes, I totally agree.
So this is a case of vitiligo. As easy as straightforward as that. How do you tackle vitiligo? What is the points to consider when you are approaching vitiligo?
First of all, depigmented lesions, maybe in the hand or in the face or any part of the body.
Okay. Let me do this with you in a reverse manner. I will tell you how I do vitiligo and you will tell me what is missing in your history. Okay. So whenever it comes to a case of vitiligo, one, I would consider this is a rash. Show me the rash from the first minute, from the first second, and you have done that. Then I have seen that this is a case of vitiligo. This is an autoimmune condition. Autoimmune condition in station 5 goes in 3 tasks. 1, the associations. 2, the triggers. and 3, the complications. Associations, I have the Fantastic 6 as associations. What are the other autoimmunes to expect in these patients?
myasthenia gravis, thyroid, diabetes mellitus, Addison, rheumatoid, like rheumatological problems like lupus, rheumatoid arthritis, Sjogren, scleroderma, some liver diseases like primary biliary cirrhosis, primary sclerosing cholangitis, and autoimmune hepatitis, maybe also pernicious anemia.
Okay.
And other skin like vitiligo and also alopecia areata. And I should ask about the drugs.
Perfect. So the Fantastic 6 for me are the ones that usually occur in the exam, and those are the ones that I need to always consider. Addison, how do you rule out Addison?
Like postural hypotension, pigmentation, and easy bruising, and like weight loss and tummy pain.
More importantly, frequent hypoglycemias.
Okay, like these spells, yes, hypoglycemia.
Yes, so postural hypotension and hypoglycemia. Thyroid, how do you rule out thyroid problem in a premenopausal female?
Like if hyperthyroidism, weight loss, and increased appetite with hot intolerance, maybe with low motion.
No. How do you rule out thyroid problems? Thyroid problem, any premenopausal female.
Like bleeding, period problem.
Female history. Yes. Not any other symptom, because any other symptom can be mimicked by other diseases. Classic pitfall in the exam. Classic, every diet. So how many points do you have for the female history?
I have 4 points for me.
6 points.
Menstruation, pregnancy, oral contraceptive pills, and previous abortions.
Perfect. Carry on.
This is what I know. This is a 4. I know. I'm missing.
Okay. Perfect. We are getting to know that step by step, regular or not, the amount. When was the last one? To know if she's pregnant or not. Any history of miscarriage. Any history of delivery, not pregnancy. And oral contraceptive pills. So 3 points non-period related and 3 points not period related. And please always remember the delivery, not the pregnancy.
Yeah, sure.
In those, you have missed one very important point, which is the amount. Is it relevant in your case?
Yes.
Hyperthyroidism will precipitate.
Yes, may cause menorrhagia.
Hyperthyroidism will precipitate.
I don't know.
Oligomenorrhea. Oligomenorrhea.
Okay.
Yes.
Okay.
Volume and hypothyroidism will cause
menorrhagia.
Okay. So Addison checked thyroid through the female history. With female history will also exclude premature ovarian failure, no point number 5. Then comes the rheumatological illnesses. How would you rule out any rheumatological disease? Any rheumatological disease will affect at least one of 3. Either will affect the skin
rash or joint pain or mouth sores.
Or the kidney.
Maybe. Okay, kidneys.
So those are my 3 questions as a screening for any rheumatological association. Do you have any skin rash? And skin rash on sun exposure. Skin rash comes in 2 questions, not in 1. Some surrogates may tell you, no, I don't have any skin rash, and yes, I have skin rash on sun exposure. So make sure that you ask the skin rash in 2 questions. Any joint pain? No. Any problem with your urine? Is it frothy? Those are the way, or this is the way how I tackle rheumatological associations. Then comes the celiac disease. Celiac, we have a reflex in station 2 and station 5. Whenever you hear the word celiac, you will remember pale, offensive,
anemia and fatigue.
No, pale, offensive, difficult to flush. This is a reflex. Once you hear the word celiac, you will come to know, or you will mention right away, لا شعوريا, pale, offensive, difficult to flush, diarrhea. Some cases of celiac present with no diarrhea. The screening symptom will be weight loss. Then comes type 1 diabetes from the history, past history, and the medication history, and lastly, pernicious anemia, which is essentially symptoms of B12 deficiency. Namely, what are the symptoms of B12 deficiency?
Pins and needles, sensation,
fatigue, peripheral neuropathy, and the hidden issue in most scenarios is going to be
also
memory problems.
Memory, yes.
This is usually hidden in scenarios especially of macrocytic anemia. So those are the associations that I'm going to look for. Then comes the triggers. What are the triggers of vitiligo?
Okay, maybe the drugs,
What kind of drugs?
antibiotics like antibiotics like penicillins and cephalosporins.
Maybe, but this is very, very rare. I would say trauma, stress, and sun.
Sun exposure.
Those are the most likely 3 precipitating factors, and that's why vitiligo usually presents on the hands, the knees, the feet, and on the face. Not very commonly to be found on the trunk. And what are the complications of any autoimmune disease? Complications of any autoimmune disease, apart from the associations, is either going to be complication of the disease itself, and this is usually the disfigurement or the psychological impact of this disease, because most of these conditions are derma in nature. Plus, only for psoriasis, it has a metabolic effect like syndrome, in which you will expect hypertension, hyperglycemia, and hyperuricemia. On the other hand, there is the complication of treatment of the disease, and namely, this is going to be corticosteroid related for most of the cases. So this applies to whatever autoimmune that presents in the exam. So in the exam, they want you to consider associated autoimmunes and the triggers and the complications. The presentation of cases like pemphigus or pemphigoid usually presents with a steroid and poorly controlled diabetes or hypertension. Among all those, what is the most likely autoimmune condition?
Diabetes?
No.
Thyroid.
Thank you. So we have something called pass or fail the exam. This will go into your pitfall paper, ورقة الخوازيق العزيزة.
Yes.
Pitfall paper is a paper in which we cover all the essential points. One point to consider ahead of that is going to be one autoimmune equals all autoimmunes. And we have checked all the autoimmunes. The second one is called pass or fail the exam, God forbid. Here we have 3 points to consider, A, B, and C. Any case of goiter essentially means a neck mass, or a case of myasthenia gravis, I have to check for obstructive symptoms. Otherwise, the examiner will consider this case as a fail because I have killed the patient. What are the obstructive symptoms to consider? Rahman?
Dysphagia, it's like dysphagia, problem with speech, problem with respiration, like shortness of breath.
Perfect.
Flushing.
So this is anything that the patient is able to do with his mouth. أي حاجة بيعملها ببقه. Breathe, swallow, speak. Shortness of breath, problems with the swallowing, problem with speech. So this is one point to consider for pass or fail. The second point is going to be any case of corticosteroids induced or corticosteroid use, or a case of Cushing. I have to offer for
Back examination.
thank you.
Bone problem.
Back examination. Even though there is no complaint from the back. Why? Because this is the most feared complication of steroids: vertebral collapse, permanent disability. So even if there is no back pain in such a case, at least offer it to the examiner, the back examination. And what are the steps for back examination? What are the steps for back examination?
Like any joint examination, inspection,
Except
for
for
joint and movement. Except for
the back examination, for someone who has done this with me before, it's going to be 4 steps, not 3. Look, feel, move, and the خازوق. ايه الخازوق؟
Lower limb examination.
Thank you.
Lower limb examination.
Lower limb neurological assessment. The back examination is never complete without the lower limb examination. Why this is a خازوق? Why this is a pitfall? Pitfall equals خازوق. Why? Because everybody forgets that in the exam with the stress. So the back examination, like any other joint, look, feel, move, and the khazuk. And I want you to remember it this way. So how would you examine the back, Dr. Ahmed?
First, local inspection, inspect the back and check
forget the details. No, forget the details. I want the headlines.
Okay. Look, feel, and move, and the khazuk, which is the lower limb.
Thank you. Allah yaftah alik. And the last point, any case of vitiligo, I have to offer for thyroid examination. Because the most likely association of vitiligo is going to be thyroid abnormality. In all textbooks. We had one doctor before, I do always mention that, Allah yamsiyah bil khair. She was a study partner of mine, and she did fail her exam entirely. Because of one station 5 case, the examiner gave her 8 out of 28 in a case of vitiligo, because only one comment in her feedback did not offer thyroid examination. For him, that was enough reason to fail the entire case. And think about it. It's just vitiligo. It's just the rash. What I'm going to examine in this rash? Absolutely nothing. So I'm going to stare at the patient for 1 minute? No. There must be something else that I should go and examine. So if we consider an approach for this case, first of all, let's agree that I do not care about a single diagnosis. I care more about the approach, which will enable me to handle whatever case. You have a case of rash. Nobody knows what this rash is going to be. So I got to see that this is a vitiligo. I will be adapting right away. This is autoimmune. So I will consider first, show me the rash. Then I will get the history. The history part here should be analysis of the rash, 8 out of 8 points, standard analysis for any case. Previous, onset, course, duration, exacerbating, relieving with examples. Association and timing if applicable. Focusing in the association on the twins. Those are mentioned in the PDF. If I have any, I will ask about. Those are in the history part. Then comes the second point, which should be the associations. So I will start ruling out the associations one by one. Then the triggers, one by one, according to the case. Then the complications according to the case. This is going to be my history part. That's it. Nothing else. After the history, I need to examine this patient properly. So comes the examination. Examination of any patient comes in 2 steps. Basic examination and a targeted examination. Basic examination is type of examination that I do in every clinical case and every case of station 5, regardless of the presentation. I will start joint by joint just by looking at the patient. You visualize the patient now in front of you. You will look at his dorsum of the hands, then the palmar aspect of his hands. Then you will go joint by joint proximally. You have the wrist joint, which will remind you to check the pulse. You have the elbow, which will remind you of the blood pressure. Then you have the shoulder, which will remind you of proximal myopathy. Then you will take a look at the patient's eyes for bilateral jaundice. Then you will ask the patient to open his mouth for any abnormality to be found there. This takes 15 to 20 seconds, pure inspection. You are very used to do that in any clinical station, and it will make you look very professional in front of the examiner. Make sense? Makes sense. And this will also provide you with a lot of valuable information, whether you consider it or not. So please do it. It will not take that long, and it will give a very good impression. Then comes the target examination. Target examination is my presentation. So from the outside, when I'm writing down my paper, essentially the same manner for station 4. I will be having, this is side A of the patient, of the paper, because I have 2 scenarios at the same time. I'm going to write down the name of the patients and the presenting complaints. The presenting complaint is my targeted examination. Not to forget that inside, and believe me, it does happen. Especially if you have a different presentation. For example, you have to examine a patient with rheumatoid arthritis hands. But the presentation of this patient, he presents with shortness of breath. What happens in the exam that you will forget the shortness of breath and you will examine the hands. And the result is going to be catastrophic. Because you have forgotten to examine the option or the organ involved. Not what you see. It's what the patient came with. So, history checked, examination should be checked, and here we will target the thyroid for examination. Then I will get the rest of my history. And why do I take social history, Dr. Ahmed?
It's a must in this patient. Social
Why?
history.
Social history in any patient, station 2 or 4 or 5. Why? Can anybody guess? He will shout at you now. Why?
Offer help.
To offer help. It might seem very easy, but believe me, it does happen in the exam as it did happen with you. Why I took social history? To offer help. Did you offer me any help, Dr. Ahmed?
No.
Who are you living with? Ask 2 questions. This is a priority in social history. And what do you do for a living? Then, do you think that your symptoms or your disease is affecting your job and your daily activity? Does it affect your job and your social life? Please ask 2 of them at the same time and offer help simultaneously. I'm sorry for that. I will involve the occupational health officer and social worker to help regarding this matter. Offering help in station 2, 4, or 5 equals 25% of your mark. Never lose it before, please. Very easy to forget, very easy to remember and collect the marks for. So, do you think that your symptoms are affecting your job, affecting your daily activity? I'm sorry for that. I will involve the occupational health officer and the social worker to help you regarding this matter. Make sense?
Yes.
Makes sense. Then comes at the very end the closure. Closure of any case of station 2 or station 5 is essentially the same. Station 2 and station 5 both are history stations. Closure equals your clinical judgment. So we need to cover this properly. We always start with the presenting symptom. You need to relate what you are going to say to your diagnosis. Then we will name the diagnosis. Then we will define the diagnosis. And for that reason, you will form a multidisciplinary team. The team will ask for investigations, will include blood testing and some imaging with or without a camera test. And you will arrange for another meeting to discuss the results and the plan of management. Keeping in mind 3 points. If you are going to admit this patient or not, you have to tell him frankly about it. If you are going to stop a medication the patient is receiving, or you are going to give this patient a painkiller. So, to apply that in your case, let's do this step by step. So, this is a case of vitiligo. And this is an autoimmune disease. So, what do I have, doctor? I'm sorry to tell you, I'll be marking myself throughout the steps. I'm sorry to tell you that the skin rash you have been suffering from is due to a disease called vitiligo. And this is an autoimmune disease, by which I mean a disease in the immune system, which is the system defending your body against infections. In your case, it is misdirected to attack your body, causing your symptoms. And for that reason, we will form a multidisciplinary team to run further investigations for you in the form of blood testing and imaging, and we will arrange for another meeting to discuss the results. So now your turn, Dr. Ahmed. Tell me, what do I have?
Yes, you have a condition called vitiligo, and don't bother yourself by the name. It's a condition of the skin due to body problem with the immune system of the body, which is the body defense mechanism, is misdirected to attack itself. And they're going to perform a multidisciplinary team and perform further blood tests and imaging, and arrange another meeting to inform you with the results as soon as possible.
Thank you. How much time did that take? It took less than 30 seconds. This is exam realistic, and this is a full mark for your case. And this is the same manner that we do for any case of station 2 or station 5. So overall, very well done, my friends. You have done very well in this case, but just few tiny points to consider, to be organized, and to go to the points right away. Thank you so much.
Okay, sure. Thank you, doctor.
Thank you, doctor. Any questions here, anyone, or the previous case?
Yeah, Dr. Muhammad, about this case. And then at the closure, shall we ask about any concerns or no in this case?
Do you have any concerns? Once you hear the word 2 minutes remaining, concern right away.
So before the closure or after the closure?
The closure is the concern. What do I have is my concern. And that is going to be my closure. I'm going to end the case, close the case to that. So what is your concern? What do I have? This is going to be my closure. I'm sorry to tell you 1, 2, 3, 4, 5 as we have discussed.
What I see.
And at the end also we'll ask about the, do you have any other concern or anything?
Yes, before you end up the discussion with the patient, turning to the
Nothing or anything.
Okay.
Nothing.
What is the relation of the back here? I came late.
It is not related to the back. This is generally speaking. I do not care about a single diagnosis. I care how you do manage any case. So if you have a case of steroid-induced problem or Cushing, never forget to ask about the back. The same for any case of myasthenia gravis or any case of goiter. Do not forget the obstructive symptoms. The same for any case of vitiligo. Do not forget the thyroid. General note, not for this case.
Dr. Muhammad,
Yes, sir.
please, we want to know the difference between medical error and negligence.
There is no negligence in your exam. Negligence equals 0 out of 16. Never mention negligence. Negligence essentially means that the team has neglected something intentionally. This is bad reputation for doctors. Simply speaking, we give treatments, we do our best. Sometimes we miss, and that is an error. Sometimes we do all our best and we do the right thing, and the patient develop complications. So it is either an error or a complication, never a negligence.
Thank you, Doctor.
Thank you, doctor.
Doctor, I have a question.
Yep, sure.
What was the legal issue in the previous case?
The legal issue in the previous case was, one, the incident reports. This is one legal issue, and the other one is the patient's complaints. He wants to submit, or she did want to submit a complaint against the team.
Okay, so how would we say that the legal issue in this case is the incident?
Incident reports and the complaints.
Okay, it's the incident report and the complaint. And also, how would we answer the concern that how long do I have to stay at the hospital?
This is the game of communication. I'm not sure. I do not know. So I will put the same simple steps for any question that I don't have an answer for. So I'm sorry regarding what's happened to you. I apologize for that. I can only imagine how terrible that is for you. Unfortunately, nobody can tell for sure what will happen in the future.
Okay.
Or if you are going to suffer any further complications. And for that reason, we will keep you in the hospital under close monitoring and regular follow-up to make sure that you are recovering nicely. So I did not say anything regarding he is going to be admitted or not, for how long. So I did not give any time frame. I did not give any promises, and I did not offer anything that's not mentioned by the consultant. So I am a good poor man. This is a full mark.
Okay, thank you.
Okay, thank you for today's session. Yes, sir.
For this kind of examination for vitiligo, I need to test for sensation loss of the lesion, or no
Need to do what?
sensation over the depigmented area.
You are considering a case of leprosy, right?
As a differential, yes.
As a differential, the most likely differential here for depigmented lesion is going to be leprosy. Leprosy is common in the Indian subcontinent, so you expect that if you are taking your exam in India, or you're taking that as part of Africa, especially in Central Sudan. Simply speaking, one of the fantastic 6 that you will be ruling out is going to be the pernicious anemia. And what are the symptoms of pernicious anemia? Having problems with the sensation. So if you rule that throughout your leprosy is not a common differential in your exam anyway. The approach covers it all.
Dr. Muhammad, one question?
Sure.
Okay. Examination of the back in brief.
Examination of the back is look, feel, and move. And lastly, never forget the hazook or the big fall, or the something that everybody forgets. Look is simple inspection. Feel, you're going to feel the back from the top till the very end.
Only 5 minutes.
And before doing that, you need to check for the letter P. What is the P? Pain.
Only 5 minutes.
Then the move, you ask the patient to move the back in all directions. Lateral flexion, and extension. If this is a case of ankylosing, you will go for the heel wall occiput test and the modified Schubert.
then the pitfall, you will turn to the examiner and tell him, if I have more time, I will consider examining the patient's lower limbs full neurologically for assessment or complication. As simple as that. We will cover that tomorrow if you wish to. Thank you everyone for today's session. Keep feeding me with cases on Telegram and WhatsApp, and we'll discuss that tomorrow, inshallah. Thank you everybody, and see you tomorrow, inshallah. Assalamu alaikum.